Good evening and welcome everyone. Today is our 1892nd day of continuous webinar. We are conducting this webinar continuously without any break in 3 languages, in Hindi, Malayalam and English. Thank you all the participants. Thank you all the faculties and the supporting team members. And today's our guest is Dr. ROHIT Srivatsan. He's MD in Homeopathy, MD in Practice of Medicine. He's the Medical Director of CR Homeopathic Research Foundation. He's a good counselor and a prescriber and presented papers on temperament. He has been treating autistic case, ADHD, delayed speech, bedwetting, hearing impairment, and many other cases, and presented his papers in international and national seminars about gallstones and fibroadenoma. And I'm Dr. Rohit. You're welcome. You are co-host. You can share if your screen also. You're welcome. Please, you can start. Thank you.
Yeah. Good evening, everyone. Thank you so much for IFPH for giving me this opportunity to present my presentation on chronic kidney disease. Is it
visible, sir?
Okay. So good evening again, and thank you, Sani sir, for giving me this opportunity for presenting my presentation on chronic kidney disease. Now, I am Dr. ROHIT SRIVATSAN. I'm a homeopathic consultant doctor practicing in Bangalore at Victory Homeo Specialty Clinic. I'm a third-generation homeopathic doctor in my clinic, starting from my grandparents, my father, and now it's me. I've been practicing here since the last 14 years. So let me start the topic for today. So let's go with the introduction about chronic kidney disease. So basically, chronic kidney disease is nothing but a gradual loss of functioning of the kidney. So here, what we see is gradually the functioning of the kidney starts reducing by several few months, years, and then we see that the functioning, the EGFR, creatinine values, they all start increasing. The EGFR starts decreasing. The chronic damage in the tissue level starts happening, which is in case if it is more than 3 months, then we put it as the condition of chronic kidney disease. So in today's presentation, we'll be studying about the chronic kidney disease, how the pathology happens, the clinical symptoms, then the homeopathic perspective about how we can handle these conditions. Now, in homeopathy, we see conditions of chronic kidney. Many of us treat chronic kidney disease. This is not something new, and which is a very regular practice for a homeopathic doctor. Now, to go ahead, so before we start understanding about the chronic kidney disease, just a small insight I would like to give about the anatomy first. So kidney, as we all know, is an excretory organ. It is bean-shaped and it is located in the retroperitoneal region of our body. The main functional unit is nephron, which is millions of nephrons are present inside the kidney. And each nephron contains over million structures, which is responsible for formation of the urine. The important blood supply for the kidney would be the renal vein and the renal artery. The renal artery will have the glomerulus and then the efferent arterioles, which would be the general anatomy for us to understand about the kidney. And kidney is again divided into 3 parts: the cortex, medulla, and there are the renal pyramids which are there. Now going forward, let's try to understand a little more on the physiology of the kidney. Now, main function of the kidney is for filtration of blood and formation of urine. The primary function is filtration. So here, this filtration of the blood happens via the glomeruli inside the nephrons. The glomerulus, which is nothing but a main structure of a nephron, a glomerulus is a knot of capillaries. Now, inside these nephrons, there is an important structure called as Bowman's capsule. All this we would have studied in our physiology during our medical practice. And this becomes important for us to understand how the physiology and what is the function of this so that we can understand what exactly happens in chronic kidney disease, why this happens, and more importantly, what conditions lead to chronic kidney disease. So in this Bowman's capsule, which is inside the nephrons, is a closed end renal tubule. So where we would see it come, there is a glomerulus inside it, and then there are collecting ducts. So basically, to understand the process, there are four processes which happens inside: filtration, reabsorption, secretion, and excretion. So to understand, the filtration process happens inside these nephrons. Most of the factors get reabsorbed. Now, over here, what we would see is in the reabsorption aspect, water, sodium, chlorides, phosphates, major ions, amino acids, all these are present inside, and most of it gets filtered and they get reabsorbed inside this, and then it goes into the collecting ducts through the, and then it passes into the process of secretion, and finally in the process of excretion the urine is then passed out into the ureters and then it gets out. Now reabsorption and secretion maintain water, electrolytes, and pH balance. Now very important to understand over here is erythropoietin, which controls. So very commonly when we treat chronic kidney disease, so we see anemia becomes a major factor. There will be hemolysis, so there will be destruction of blood cells, so there will be low hemoglobin. So because the erythropoietin hormone gets affected. Then BP, hypertension becomes a major factor because this can lead to increased pressure inside the capillaries, which is a inside the Bowman's capsule, inside the nephrons, which causes damage to them, lowering the kidney function. Then calcitriol, which is very important. Now, this is another important factor in physiology, which again helps in maintaining the vitamin D activation and calcium related. Now, many a times we see when we treat kidney cases, there will be low calcium level also. Now, why does this happen? Because of the calcitriol, which gets affected. What happens over here when this when this equilibrium changes? So what happens? The calcium content inside, now blood calcium level starts decreasing. Now, because it starts decreasing, the parathyroid hormone starts to produce. So it's a factor where it starts to make sure that more calcium is made sure it enters into the bloodstream. And where does that happen? It happens from the bones. Now there will be destruction basically which happens, the calcium loss which is seen, and that enters into the bloodstream to manage it. So all this leading to again hyperparathyroidism becomes another condition over here. So this is very important for us to understand what exactly kidney is taking care, and this becomes very important. So filtration of blood, formation of urine, which is basically the excretion, and then the erythropoietin factor, which is very important because anemia becomes a very big factor when we treat cases of kidney diseases. BP, which is again very important, and I explained the calcium aspect as well. Now, glomerular filtration rate, which is very important and the main factor for us to understand how the kidney is losing its functioning, whether it is going down, and that we can get to know between the values being a normal value between 90 and anything above that up to 120, which is the normal value. Now, kidneys play a very crucial role in managing the homeostasis of the body. Going forward, the pathology of chronic kidney disease. As I just explained you, diabetes mellitus, hypertension, chronic glomerular nephritis, polycystic kidney disease. These are some of the precursors, the cause factor leading to the formation of chronic kidney disease. This is a chronic condition. Gradually, the kidney starts losing its function. It's not that the kidney would start showing effect immediately. Very slowly, the tissue changes start happening. Now, many a times where there's increased hypertension, what happens? The nephron starts getting affected and they start losing its function. But still, the kidney still, as a human body, human body will always try to make sure that it gives its best to take care of things, and our body runs the function to make sure it survives in the optimal level. So even though some of the nephrons are lost, still the body tries to manage it by giving optimum function to the surviving functional nephrons. But still, gradually, as the disease progresses, they also lose its effect, the efficacy, and then gradually it leads to renal failure. Now, because of these nephron loss, glomerular sclerosis happen, leading to fibrosis and renal failure. Now, to understand the stages in which these happen, there are 5 stages in which we can categorize our cases of chronic kidney disease. Stage 1 is anything where there will be normal with very mild tissue level changes. Now, we can understand this tissue level changes with a simple ultrasound scan. So they would show changes in the renal epithelium. All that we will be able to appreciate in a simple scan. Then stage 2 will be 60 to 89, stage 3 30 to 59, stage 4 15 to 29, and stage 5 anything less than 15. Think I have explained this. Now I'll just go ahead with the next slide. Now, to understand a little more about this, food plays a major factor in these conditions. Always when I treat cases in my clinic, so as I told you, I consult in a very old clinic. It's a very 53-year-old clinic in Bangalore. So see a lot of cases, and chronic kidney cases is something which is very commonly treated in our clinic. Now, while prescribing a medication, food becomes very important. Like even Dr. Samuel Hahnemann has also mentioned in the book of chronic diseases, a very specific significance is given to diet and regimen. So diet becomes a very important factor. Not that when you give homeopathic medicines, you're not supposed to eat 15 minutes before, 15 minutes after, don't eat or drink, or don't drink coffee, tea. That is not just the important thing. More important thing is trying to highlight the patient. Now, very important is many a times we give our medicines, but the patient would end up eating anything and everything, because many a times I see not only kidney now, and today I'm presenting on chronic kidney disease to highlight on simple cases of kidney stone. Patients who have kidney stones come to clinic, but they would still continue to eat cucumbers. They would eat palak, spinach regularly. Now, if you don't advise them to stop eating them, tomatoes, you need to explain them that they are rich in oxalates. You need to tell them if they have small multiple stones, then uric acid becomes very important. We need to tell them why uric acid becomes very important. They have to make sure that they should reduce foods which are high in purines. So likewise, even in chronic kidney disease, we need to advise the patient to eat very less high sodium food. So salt intake has to be controlled. Then potassium related. Now this is very, very important. We need to advise them that they're not supposed to eat green leafy vegetables. Green leafy vegetables, now very important, because there are patients, especially South India, where green leafy vegetables, be it Karnataka, Tamil Nadu. So there are patients who have these leafy vegetables very regularly, frequently cooked. So we need to explain them that no, they're not supposed to eat them because they are very high in potassium, which can affect the functionality of the kidney. Now, phosphates, potassium, sodium, all these are very important because kidney takes care of the electrolytes of our body. Any issues in this causes immediate change in and strain on these kidney to the nephrons, and that leads to lower functioning of the kidney. Now, fruits, very importantly, I would rather say apple is the only fruit which they can have. And if you're diabetic, no fruits at all, because majority of the fruits are high in potassium, especially bananas, which is again very commonly eaten because everyone soon after a meal, they would always have a banana, which is very common to take care of their digestion. So important is this. Again, non-vegetarian. So eating whole meats, red meat, mutton. So all these are very important that we guide them that they're not supposed to have them very regularly. Dairy food again. So dairy products, very commonly milk, curds, cheese, all these are very important. Again, oil. So many a times what happens, they would end up eating too much of deep oil prepared food, spicy food. So we need to guide them. It's not that they need to completely leave everything. It's just that managing and eating the right food would try to take care of the condition so that the recovery and success rate will be much better. And alcohol, of course. And coffee, aerated drinks, Pepsi, Coke, all this has to be controlled and stopped. Going forward, clinical symptoms. To understand about chronic kidney disease, the more important we need to see is, because this is a very chronic condition. So we need to make sure that patient would only experience small symptoms like fatigue, weakness, or some mind related. So where they become very dull, sluggish, uh, low in comprehension, or memory at times takes a back seat for them. Edema is something which is very commonly seen, where the face gets flushed, or there will be edema in the lower extremities, especially the ankle, feet, or the lower limbs, the legs, ankle area. So these are the common places where we would see edema. Edema, again, it could be a pitting edema, non-pitting edema, depending on the condition. So very commonly, renal dropsy is the condition which we would see. Nausea is something which is again a common symptom which we would see. Loss of appetite, a patient would not feel like eating much. Then there will be decreased urine output. So many times we would see this condition as well, where the patient would slowly feel that he's passing or she's passing very less quantity of urine, and frequency of urination is also lowered. At times there will be nocturnal urination which can be felt. There will be retention of urine which will be seen. Sometimes the patient, because of retention of urine, they would be having a constant urge. Now, many a times these chronic kidney disease can be comorbids. So where they would have diabetes, they would have hypertension. In case of gents, they would have, because it's an old age complaint. It's not something which happens for a middle-aged person. So it's an old age complaint. So prostate is again a very common condition which associates with these conditions. So we would see an enlarged prostate. So because of enlarged prostate, there would be retention of urine. So with retention of urine, the patient always has that urge incontinence. So that with scanty urination, all these plays a major factor for the patient who suffers from a chronic kidney disease. Apart from that, the patient would also experience itching, breathing discomfort. Now, breathing discomfort, why? Because of uremia, increased urea levels. There will be albuminuria, protein loss will be there, weight loss will be there to these patients. Now, hypertension again. So it can be likewise, it's a cyclical condition. So patients with hypertension end up with chronic kidney disease, or chronic kidney disease patients also have hypertension. And there would be joint pains which patients suffer from, puffiness of eyes, muscular cramps. All these are common clinical signs and symptoms which we would see in a case of chronic kidney disease. Now, investigation. Now, as doctors of modern medicine, and homeopathy being the most modern system which is introduced, investigation becomes very important. So we need to always make sure that we do investigations. We should make sure that we guide the patient to not just chronic kidney disease, in general, as we are preservers of health. So we need to make sure that we guide our patients to make sure that they undergo routine testings to make sure that all their parameters are taken care well. Because these are very silent conditions. Sometimes they would not come to know. Sometimes they come in the stage 4th level, stage 3 level, where there would be already organ damage loss, which would be already seen. Now, investigations important over here would be creatinine value, serum creatinine, urea, electrolytes, basically the sodium, potassium, chloride, phosphates. All these are very important values when we are treating a condition over here. Then a general urine test becomes very important, proteinuria, to understand if there's any protein loss. So immediately protein loss indicates there will be some issue in the kidney. Uric acid level. Now, uric acid levels become very important. Uric acid diathesis, our books, most of our Metra Medicas explain uric acid diathesis in Metra Medica, most of our medications. And many a times I've seen variation in uric acid very immediate following month only, there would be difference in the readings of creatinine, urea levels increasing. Ultrasound will help us understand whether there will be decrease in the size of the kidney, and GFR estimation to understand how the kidney functioning is happening. Then chloride protein loss, total protein. So albumin, globulin are two types of protein. So here in blood urea is a terminal product of protein metabolism. Protein can produce about 0.3 gram of urea. And creatinine. Now creatinine is very important as a chemical waste product in blood that passes through the kidneys to be filtered and eliminated in urine. Now, we always use this as a very important index in understanding the creatine value in our patients to understand how the kidney is functioning, and understand how the case is progressing as well. Now, apart from that, sodium becomes very important. So the sodium values are important between 135 to 145. Anything lower than that, patient can always have symptoms of too much of fatigue. There will be dropsy condition, there will be fainting, patient, all this becomes very important. High potassium, everyone knows it can lead to hyperkalemia conditions, and hyperkalemia, increase in potassium, can lead to cardiac arrhythmias. Because of cardiac arrhythmias, the patient will have irregular heartbeat, there will be BP variations, and the patient can end up with cardiac arrest. So these are very serious conditions, and we have fantastic medicines to immediately reduce our potassium variation in the electrolytes. I'll explain you all that in the further slides. And of course, chloride and total protein, which is very important because albumin, in most of our Metromedica, we will always read albuminuria, protein, or we would always read terminologies like Bright's disease. All these become very important, as in our Metromedica, we don't have anything as creatinine mentioned in our Metromedica under urinary system section, or it is not mentioned as chronic kidney disease. So we need to interpret, understand how we can use our Metromedica in treating and understanding the conditions. Differential diagnosis, acute kidney injury. So the onset will be very sudden. There will be immediate decrease in urine output, which can lead to suppression of urine in cases of acute kidney injury. Nephrotic syndrome, we all know about that. There will be majorly proteinuria and a lot of dropsy conditions. So edema becomes a very important condition in chronic in nephrotic syndrome condition. And chronic glomerular nephritis, again, it is an early cause leading into the chronic kidney disease, where there will be glomerulonephritis, there will be inflammation in the nephrons, and then that leading to increase in albumin, proteinuria, and there will be excessive edema. All these are conditions of chronic glomerulonephritis. Diabetic nephropathy. Now, this is very important. Any case of diabetes, we need to make sure that their kidneys taken care well and healthy. So in cases of diabetes, when we treat, we need to keep monitoring the creatinine values to make sure that everything stays under control. Because uncontrolled diabetes, long history of diabetes can always go in for kidney damage leading to chronic kidney disease. Now, coming to the homeopathic approach. Now, approach always has to be individualization and constitutional treatment. Now, this is something which is very important as homeopathic doctors, which is our edge, which is our specialization. So, which we stand out against all the other systems is our constitutional treatment, where we tried because our case taking is art and science. So it's just that we have to make sure that we try to hit the right minimum, take a wonderful case taking, try to be as keen observers of health to understand, try to take in the most important rare symptoms so that we get the right minimum. So we need to understand the mental state of a person, the temperaments, the physical conditions, particular symptoms, of course, the disease symptoms. Knowledge of the disease is also very important as in aphorism number 3. And chronic diseases, we need to understand how we can use our miasmatic medicines to make sure that we try to take care of the case much better and try to avoid a recurrence, or where we see the case comes to a standstill, where we need to get a better success. So we have to use antimiasmatic medicines, sometimes intercurrent medicines. Swords can be used. Now, for all this, totality of symptoms becomes very important to guide us how the treatment has to be taken. So we need to be very how do I say, keen observers to make sure that we hit the right symptoms to get the right simillimum over here. And peculiar symptoms are the key. And chronic disease management is of course given in aphorisms between 186 to 203, which a whole mention has been given on how we have to handle these conditions of chronic diseases, how we have to take care of managing the diet regimen and treating the conditions where we have to use miasmatic medicines, and how we can take it forward, how we can use our constitutional medicines, or we can always use medicines where we can use sometimes in some cases where in case we are not in a position to hit the right simillimum, we have to make sure that we take care of conditions where we try to get a partial simillimum, and we need to see how we can reassess the case, get the totality, and treat it accordingly. And then the therapeutics. So over here, important. Now, this is very important in treating chronic kidney disease. Yeah. So over here, important therapeutics over in treating the chronic kidney disease. Apis mellifica, Apiocynum, arsenic album, Berberis vulgaris, Cantharis. Other important medicines to highlight would be cupromaz, eel serum, calichlor, terebinthina, senna solidago, uva ursi, zingiber, Rus aromatica. Now, I'll speak a few important medicines over here in the therapeutics, and I'll explain them also later on. Now, Apis mellifica is a very important medicine under chronic kidney disease, where we would see albumin, where we protein loss, which we can see in the urine report, and dropsy, face flushing, edema. All these can be very important condition for us to indicate Apis mellifica. Apart from that, when we read Cuprum Ars. Now, Cuprum Ars is something which I use in my practice many a times. Now, Cuprum Ars is a medicine where it indicates, now when we open Clark Metromedica or Boric Metromedica, he would say the functioning of the kidney is lowered. So Cuprum Ars has a very deep action. It's a very deep acting medicine, which I have used in my practice many a times. Now, why I say therapeutics? Now, therapeutics and constitutional medicine treatment, but we have therapeutics in our system is very important. Is many a times we would not be in a position to get the right simillimum, but that doesn't mean that we cannot treat the condition. Our medicines are, again, there are many medicines apart from polycress which have not been proved completely. There are so many medicines in our Boric Metromedica which have very small, very important key indications which have been mentioned in them. And these medicines work and they give results accordingly. Now, for example, if there is cardiac related leading to chronic kidney disease, we can always think on medicines which like digitalis. If there is uremia conditions where there will be excessive of high urea levels in the body, there is too much of urine in the protein, eucalyptus is a very important medicine. Now, we all know eucalyptus we use in respiratory conditions, but eucalyptus has a very important therapeutic value in managing conditions of this. Thalapsy bursa. Now, Thalapsy bursa is again a very important medicine which has a high uric acid diathesis. Wherever there is high uric acid diathesis, where there is creatinine variation, urea level variation, now Thalapsy bursa gives results very nicely. Now, similarly, calichlor. Now, like I said earlier, potassium, when there is any variation in the potassium values, calichlor is a very wonderful medicine which I have used. very deep acting medicine, even in Allen's keynotes and as well as in Clark, where they mentioned that this medicine is to be not administered very frequently, like Kali iod, Kali chlor, any of the Kali groups. Basically, they're sorosyphilitic uh, medicines. It's a very deep acting medicine. So few doses of Kali chlor, the value of potassium fantastically comes down. So any cases where there is hyperkalemia conditions or ketoacidosis, so all these conditions, or in general electrolyte variation. So Kali chlor is a medicine which I have used and fast results, very fast. And of course, Lycopodium, arsenic, these are polycrysts. They always have phosphorus. They have wonderful action. Now, apart from this, zingiber. Now, zingiber is another medicine in Boric Metromedica, where he would say there will be complete cessation in the functioning of the kidney. So there are very few, and apart from them, now another thing in our Metromedica where they would highlight is Bright's disease. Now, Bright's disease is nothing but glomerulonephritis. So where there is nephrotic syndrome. So there is proteinuria. Now, we need to understand that when a medicine is having its purification on kidney, which can show damage leading to protein loss or uremia, urea, protein in the urine. So that means that medicine has an action to improve the functioning of the kidney. So it's just that how you have to interpret it to understand and how we can use it in our practice. Now, going forward, the Metromedica. Herpes mellifica, like I explained, edema, burning sensation, scanty urination, retention of urine. Apart from that, Herpes mellifica is again very commonly used medicine for prostatitis conditions. So this medicine can be used in conditions for chronic kidney disease. Arsenic alb in cases of uremia where the values of the creatine values are very high, patient is very weak, restless, there is too much of fatigue, uremic levels, so there will be a lot of toxicity, darkish discoloration in the extremities, uh, scant urination for all that condition. Mercor, suppressed urination, albuminuria, then phosphorus, post-infective nephritis conditions. We can think of phosphorus as a very key medicine. Terebinthina, now this is another very important medicine where we can use it for dropsy conditions. So wherever there is dropsy condition, renal dropsy, edema, leading, and there is chronic kidney disease, dark urination, hematuria, for all these conditions, terebinthine. Terebinthine is again a commonly very used medicine for urinary tract infections. Solidago. Now, this medicine again is used as mother tinctures and as potencies where it has been used for chronic nephritis condition where there will be suppression of urine, proteinuria. So these are just those terminologies which we can get in our urinary system when we open Clark Metromedica or Boric Metromedica. So we would see these terminologies used in those books, which we have to try to use them accordingly in our practice. Lycopodium, again, right-sided remedy, kidney conditions, uric acid tendency. We can always think of this as a commonly used medicine. Now, remedy selection has to be on the basis of totality of symptoms, constitutional type, miasmatic background, and temperaments is something which I always use in my practice so that it helps me to understand and get a small cluster of medicine so that I can pick the symptom and treat the patient accordingly. Because, like I said, I consult in a very old clinic. There is a lot of patients which I treat. So number of hours, number of time which I get to take for a case is less. So I need to be very quick, sharp, and try to hit the right minimum as much as possible. So this is something which I have used in my practice. Now coming into the case presentation. Now this is one of the case of chronic kidney disease where I have this patient is an old man. He came to me with tiredness, loss of weight. Their children brought him to the clinic. So in this case, again, as I could understand on taking his case, so there was so this patient was very irritable. Of course, he's aged, so that is quite common. And then because his creatine values were high, he was quite having a lot of delusion. Sometimes he would not be in coordination with the reality around. So, and he was very talkative. and he was very affectionate with his. So they say sometimes he becomes very irritable with his son and his wife, but with grandchildren he's very affectionate, and he's a very big businessman, so he's a very intellectual person, so that I could take out by understanding how he is. He was trying to speak about how his business, basically he's into construction, so he was one of those realtors, constructors in Bangalore. So they're into a very big empire of construction business. So when he came into the clinic, so there was a lot of he's an old man, so there was a lot of command which was seen in his body language. Uh, so there was a lot of confidence. So there's command in his personality, and he was always trying to speak about how uh, he has tried to manage his condition over the years. Uh, he's been, of course, it's whenever you see patients coming finally to the homeopathist, they would have gone into so many hospitals, so many methods of treatments have already done. They would be on so many other medications, and they come over, and then they would always try to speak about so many other things they have done, so many other procedures they have thought of, so many other things. They were even planning to think, if the condition doesn't agree, then his doctors had had also mentioned that if things don't go on the right track, there can be chances of him going into dialysis, and sometimes if they have to think on a transplant condition and all that. So while talking to him, by assessing his intellect, by understanding how he was approaching to me as a doctor, uh, all this now, as he was a very uh, workaholic kind of a person, now his gradually he had become very disinterested to his work. This was something which was very important. Now this is a very important syphilitic symptom of lycopodium, so something which they are very workaholic, responsible nature, suddenly he is getting aversion to it. Basically he is losing lack of interest onto all those, and very irritable nature which was coming up when he was in between talking to his children, where they were trying to interrupt him in trying to express some other things or show his reports to me. So in his condition, so his urea levels were high, his BUN levels, creatine values were 3.39. Lycopodium I had selected. Initially I started with a lower potency, because this is a pathological condition, it's a chronic condition, there is damage to the kidney, GFR is low, that means the nephrons are not functioning. So I started with a lower power, then I started going into the further after a month, while the next prognosis or condition, his creatine got better, it came down to 3, and then his urea levels from 161, it came down to about 119. His BUN levels started improving. And then further on the next follow-up in September, his creatine further came down to 2. He was looking much better, much fresh. Then further changed to the prescription to 1 m, since the things are going on the right track. And now recently, about 2 days back, his son shared me the report, because they're on travel. There's a wedding in the family, so they couldn't come and visit me in the end of October. So they had shared me that his creatine value has come down to about 1.89 currently, and he's doing okay. And probably I should be able to visit. They'll be visiting me shortly in the next couple of days. So this is the lab reports which was shared to me over the months. So the same measurements which was given earlier, his creatine 3.39, later came down to 3, 2, and now it is 1.89. So when we hit the right medicine, so when we get, so like I said, constitution medicine is the best thing which can happen. Both for us as homeopathic doctors, if we get the medicine, it's the best thing. And for the patient also, it's the best thing, because the recovery, the prognosis, everything gets at the right track, everything goes at the right pace. But when we don't, uh, case takes its own time. But still, it's just that many a times we don't get the right medicine, so we always have our therapeutics to use. And I would always say, we have 10 fingers, so we should have 10 ways of practicing, because not all the time we can get constitution, because many a times today's world, apart from seeing physical patients, some of my patients are through WhatsApp, some of the patients are through online, emails. It's so patients are so busy, even they don't even want to even have a video consultation also. They would always speak to me on the phone, send the report. Any symptom, no symptom, please go through the report and send me the prescription. Or say, please send the medicine through couriers. So that's how life has become today, especially Bangalore being a metro city. Management of cases have become very different. Now, this another case of kidney disease. Again, an old man. Like I said, chronic kidney disease is not a young man's problem. It's an old age issue. So he again came with a condition where there was excessive tiredness, fatigue, and there was he's a diabetic since 20 years. So his physical complaints were he had constipation, frequent urination, though the frequency was more, scanty urination was seen. He used to wake up in between, so nocturnal urination was there. His thermally was chilly. Now this person was very intellectual, very fastidious. Now this person, fantastic. When he came to clinic, he came with his reports. Now old man, still he came with his reports and he had sticky notes mentioned on it for me to understand which date I would ask him, which ultrasound or which MRI report or summary of his whole creatine values, his BUN values, or his diabetic values. Everything was mentioned in a tabular form. Even at this age, it was so systematic. And then systematic, it has to be, it's very easy for us to pick up with keeping his condition. So arsenic was selected. Of course, we can also think of carcinosin as well in this condition, but keeping his arsenic having an action on uremic levels, his creatine value being about 4.4. I started with arsenic at 30 as my prescription. And then, so I saw him in Jan of this year, and then his urea levels 94. After the first month of prescription, the following month, his creatine values did come down a little, so it came down to about 3.8. Again, likewise, in cases of chronic kidney disease, I always go step by step. So always in cases, sometimes I don't get the right similum. Sometimes I start with sixth potency. Now, sixth potency of cupromaz, sixth potency of terebinthina, sixth potency of zingiber. So, or the eel serum. So these are the medicine. Now, eel serum is hypertension. So hypertension relating to chronic kidney disease is eel serum. So all these medicines, I always start with a sixth potency, then gradually go how the case is going forward. Then I go to the 30th, then 200 potency. Likewise, I take it forward depending on the condition. In this case as well, so arsenic alb was given initially 200 potency, then further ahead, the case got better. Then I went ahead to the 1M potency. Then further ahead, case got much better. He was, the leg swelling, the edema was much better. So urea levels came down drastically. Then I went ahead to the 10M potency. So over here, it came down to finally in the month of June, his creatine values came down to about 1.7. So this is how I've used arsenic help. So like I said, we all treat chronic kidney disease. It's just that out of uh, 10, 20 cases, maybe 1 or 2 cases, we get the right simlimum. But the other cases, it's just that we don't. But again, it's the fault of the homeopathy, I would not say, because homeopathy always shows results, and that's the best part of homeopathic system. It's just that sometimes our knowledge, our efficacy, sometimes we are not able to get the right simillimum. But when we get, we can see how wonderful the results can be appreciated in our results. Now, apart from this, now I already explained a few cases. Now, many a times in my clinic, when I see cases, with, as I already expressed it when I was showing you the therapeutics, talapsi for uric acid variations, I have used them. For urea variations, this. And now very important when I treat diabetes cases. Now, diabetes cases leading to chronic kidney disease. Rus aromatica has been a choice of medicine for me. Now, Rus aromatica I use generally for treating diabetes mellitus also. Now, apart from the acid group of medicines, we use acid first, and we use acid sulf, acid acetic. All these are very commonly used medicines for diabetes mellitus treatment. Now, apart from them, when a case is going where there is kidney changes, there is damage in the tissue level of the kidney, the GFR going low, creatinine variations, Rus aromatica I have used in my practice for a lot of cases, and I've found it being helpful in lowering my diabetes reading also with this. Now, I would always say these are easy, I mean, these are handy prescriptions, but as much as possible, where in these cases, what I do is sometimes I use miasmatic medicines in between as intercurrents, or I still try to search the totality where I can still get a little closer simillimum where I would use it. So sometimes when I get a closer constitutional medicine, I would prescribe the constitutional medicine uh, once or twice in a week. Whereas these medicines I would be prescribing a little more frequent because they are not constitutional. So I need to keep repeating them a little more frequent. So this would be my weekday prescription. A constitutional miasmatic would be my weekend prescription. Then digitalis, again, like eel serum. Digitalis for cardiac eel serum, hypertension. Now, many cases we would see in our blood reports, now patients come with uncontrolled hypertension, or they would come with a report with microalbuminuria levels being on the higher side. Now, here the kidney damage would not be there. Many cases where initial stages of chronic kidney disease, there will be very minor kidney tissue level changes. EGFR is good, creatinine values are still good, but microalbuminuria levels are high. In such cases, I have used eel serum and Viscum album. Now, Viscum album condition, so where under Kent repertory, also he mentions uh, urine, specifically urea in conditions with hypertension in boric metamedica as well. It has been mentioned. Viscum album. Now, conditions where there will be increase in the urea level. So microalbuminuria level leading from hypertension, Viscum album has been used in my practice, and I found good results in lowering the microalbuminuria levels. Apart from using terebinthina as a medicine, uh, in such cases also microalbuminuria. Of course, any conditions where there is proteinuria, albuminuria, we all know there are so many commonly used medicines in diabetes. Of course, we use acid phos. Now, acid phos is wonderful medicines for diabetes. Protein related conditions, uremic conditions, it can be used. And Oromet is another important medicine where we would see proteinuria. So nephrotic condition, nephritis condition, fever. Now acute nephritis where there will be high fever conditions, there will be protein loss. You would see urine 3 plus protein. All these conditions, Oromet is a wonderful medicine. Apart from Oromet, of course, Mercor is another wonderful medicine which can be thought of. Then Apocinum and Epismil for dropsy conditions. Apocinum is a typical renal dropsy condition where there will be uh, edema in the legs, and Apis mellifica specific for pitting edema. We can think of that. Senna as a mother tincture can be thought of in cases of uremia, proteinuria. Senna mother tincture has given me good results. And Cupromars and Zingiber, I've already explained in the earlier slides how they have been highlighted in our Metamedica, which we can use. In cases of polycystic kidney disease, now in these conditions, or many a times we would see cortical cyst in the kidney. Now, cortical cyst in the kidney, if they start increasing in size, so they over time that would lead to lowering of the kidney function, not directly, over the years. For such conditions, also I have used calcarea carb. Calcarea carb in initially lower potencies, then I went into higher potencies, and it has given good results. Polycystic kidney, of course, this is a very chronic conditions. In such conditions also, calcarea carb has helped in these conditions because it's again a psychotic medicine, miasmatic medicine, which can be thought of. High potassium level, calichlor is a very important medicine. Conclusion, now homeopathy offers holistic approach in treating chronic kidney disease, and totality of basically symptom totality becomes very important. Now here the important thing is to improve the quality of life, reduce the complication for the patient, and majorly why patients come to us is scare of dialysis. And yes, we don't want the patient to go into dialysis. There are so many cases through homeopathy which we have achieved success where we have avoided dialysis for patients. Many nowadays, what many patients have, I've seen cases where they go in for temporary dialysis. Young people go in for temporary dialysis uh, with simple creatinine values of 4, 5, and they don't even, it's just that sometimes patients don't know much about this. Homeopathic science can also help them. It's just that we need to, and whenever we do get a chance to treat such conditions, we feel so nice that we've been able to achieve that they're out of dialysis, or basically we could rule out dialysis. Now, in cases of dialysis also, now very importantly, in chronic kidney disease, there are some patients who come to you with, who are already on dialysis. What do we do for such conditions where they would be on dialysis, their creatinine values are still going on the higher side? They would be going 4 times dialysis in a week. Now, what we can do at that time, it's not that we can cure the condition, it can be supportive. So for such conditions, when we give our medicines, at least the number of dialysis round which they are going, so there are so many cases where they're going 4 times, they have come down to only twice a week. So at least that we are in a position to achieve. Sometimes where their urine function was less, so many cases where there will be scanty urination, suppression of urine. With our medicines, at least the urine functioning is better. And many cases where there is suppression or retention of urine, there are so many medicines of ours which we can use. Cantharis, gelsemium, and in very acute conditions where there's sudden suppression, aconite. So all these are medicines which we can think of, and many conditions where this urea medicine also, which we can think of. And apart from that, uh, I mean, I can start speaking more and more about so many medicines which we can think of in our science. So finally, our aim is to treat the patient, not the disease, which is what our founder has told us, Dr. Samuel Hahnemann. So which is very important. And every day in, day out, every day in my practice, I always try to make sure that what best I can do in the clinical practice, where I try to get the best same minimum from my knowledge. Sometimes where I don't get, I always try to see what best I can do to offer to the patient. The references I've used is the Organ of Medicine, Boric, of course, my Clark Metamy, my source book, Allen Keynotes, Davidson, and other few other important research which I've done in my clinic. And thank you for your patient hearing. I hope I've covered most of the things. And thank you so much for IFPH for giving me this wonderful opportunity to present small information from my 14 years of experience in clinic in managing chronic kidney disease. And thank you so much, Sani sir, for giving me this opportunity.
Thank you, Dr. Srivatsan. It's really a wonderful explanation. You explained from anatomy onwards. It is a really a great gift for us, because you explained everything very clearly. It's crystal clear. Thank you so much. And the participants, you can raise your hands and ask question to Dr. Srivatsan. Okay, the next doctor. You can ask.
Thank you, Dr. Rajini, and good evening, Dr. Rohit Srivatsan. It's really a very good session indeed. And at the younger age, at this young age of 14 years of experience, you really rocked the session with your knowledge and courage. Because usually chronic disease, kidney disease is a big problem for most of the doctors, because how one can manage these things. This is one of the area where most doctors shows a little bit of a discomfort to take the case and go ahead, because at any time you can there can be a possibility of damage to the patient. But in most of the chronic cases, chronic kidney diseases, what you told here was right. Maybe due to the long continuing medication from the other side. And also, we can see that only 10% of the real patients are coming with typical kidney disease that may gradually develop into chronic disease. But also in other cases, we can see that most of the patients are taking regular medicine from other side, particularly for diabetes or for hypertension, like that. And that may be the very important, that may be the precipitating factor for that also. But I just have a query about a patient today. The patient was a non-diabetic, and he was having hypertension. She was having hypertension. I was used to take medicines regularly, but she was a chronic kidney patient who is having the kidneys very small. And recently there was she was admitted with the coma. It is condition in IC unit, and the problem is that hypoglycemia. There is always a hypoglycemia is coming. What can be the reason, and how can you manage that case in with homeopathy? What is your opinion on that?
Now, in such conditions where the patient is currently in ICU now, is it?
My son had called me just in the evening, and actually, in those conditions, how will you manage? That is the problem. That's the question I would like to. It can be. What can be the reason for? It may be the long continued medication that may be the reason.
Yeah.
What are the other reasons you think? Think for the same.
So, like I said, like for cases which is related to conditions relating from hypertension going into a kidney damage. So, what we can do is initially start with lower power medicines, lower potency medicines, so that we can start working on these conditions to make sure medicines, like I said, eel serum can be a very important medicine in uremic conditions leading to from a hypertension condition. So few doses of that can help, and if we can get some more symptoms where we can understand if some constitutional can be thought of parallelly, which we can think of adding on to it, will be a better choice for us to try to handle such conditions. And hypoglycemic condition, that's difficult because there's no medicine in any science to handle a hypoglycemic. It's always the diabetes or hyperglycemic is what we can always handle better.
But it is according to them, it is maybe it may be due to the overproduction of insulin, and what can so they advise the patient to take a PET scan tomorrow.
Okay.
And that's the present position. And as you rightly point out, the serum can be the remedy for that also. Sometimes because of the overactivity of this pancreas to produce these things, sometimes tuja may works in those conditions because it is hyperactivity of the.
Yes, sir. What I've done is I've
be
used cuprum Rs in one of these conditions where patient is hospitalized, and I have used cuprum Rs 6th potency. So in such conditions, because of this uremic level where the patient is showing, so all these conditions where there could be variation in the electrolyte, so it could be the potassium variation or it could be the sodium variation. For all these conditions, we have used cuprum R 6th potency. So trying to balance the electrolyte level to make sure that this can be handled better.
Dr. M. Srivatsan is raising hand, sir.
Yeah, yeah. What Dr. Danesh is trying to say, if we consider this as an oversensitivity, an alkaloid of Naxwamica, that is, I think it is strychnine. So probably strychnine, one dose can, shake up the whole thing, and you may get a proper picture of the case.
Exactly.
The oversensitiveness, when we talk about Naxwamica, the chronic of that will be strychnine. I think one dose of that can lead us to a better medicine.
Thank you.
Thank you
very
so much, sir. Thank you for your suggestion. And proudly, I think you are watching the, webinar. Thank you so much for coming. And thank you, Dr. Rohit, for joining with us. And thank you, everyone, for the participation. And now I am handing over the session to Dr. Mariamma John for moderating Malayalam session. Good night to everyone. Love you all.